Hello, everybody. Thank you for joining us. My name is Bridget. I'm with Central Minnesota Jobs and Training Services. I'm a business service coordinator, working with businesses and trying to help job seekers and businesses connect and grow. The purpose of today's event is to talk about healthcare related careers. And how we're going to do that is we're going to have two employers present about their businesses, the type of career pathways that are available in healthcare, and also share some information about Central Minnesota Jobs and Training and our youth program. Our goal is to spread the word about all the careers that are in healthcare, because there's so many different career pathways. There's nursing, which we all know, but there's also activities, occupational and physical therapy, maintenance, medical records, medical building, health unit coordinator, just so many different ways for you to get into a healthcare related career that pays a living wage. The average wage for a healthcare career in Minnesota is about $53,000 a year, which is like $27 an hour. So it's a great career pathway to get into, depending on your interests and abilities. So I would like to start first by introducing Mel and Delina so they can talk about CMJTS and the youth program. Go ahead, guys.
Hi, my name is Delina Welcher. I'm a youth employment specialist with Central Minnesota Jobs and Training Services, and I cover the Canyon High and Renville County area.
Hello, everyone. My name is Mel Schrader, and I am a youth employment specialist with Central Minnesota Jobs and Training Services, and I am based out of Meeker and McLeod County. So in our youth program, we help eligible youth and young adults ages 14 to 24 to help them with their employment and training goals. We do that by assisting and connecting the youth and young adults with career pathways and by increasing their employability and earning potential. How exactly we do that completely depends on each individual youth. So the individual services that each youth or young adult needs, we go from there. And Delina is going to talk a little bit about some of the services we provide.
Thank you. So all of the services that we provide are on an individual basis. We work with the youth to determine their goals and how to achieve those goals. If a youth is going to college, we may look at career pathway and post-secondary training exploration, labor market information, job shadowing, occupational skills training, financial literacy, and budgeting assistance. We could also look at post-secondary transition services and tuition assistance to programs that lead to a recognized credential and that are a high demand field. We also assist with dropout recovery services. If the youth is interested in gaining some work experience while in or out of school, we may look at doing a paid or unpaid work experience or internship. We can focus on job shadowing if they're exploring different careers, help with entering an pre-apprenticeship or an actual apprenticeship program. And we can work with the work readiness skills training, leadership development, and so much more. Some services that are across the board, whether in training or working, we can provide financial assistance, monthly check-ins, and follow-up services to ensure continued success.
All right, thanks, Delina. And like I mentioned before, we serve eligible youth and young adults, right? So what makes youth eligible? There's quite a variety of eligibility factors that can help a youth become eligible for our services. I'm just going to list a couple here, but please know that this is not an all-inclusive list. So there are other reasons that a youth might be eligible, and truly the best way to find out is to contact us. And I have shared on the screen are Delina and myself's our contact information. So feel free to contact us with any questions. Our phone numbers are work cell phones, so you can text them or call them, or our email addresses. But some of the reasons why a youth or young adult might qualify for our services include if they have an IEP or 504 plan, if they have any form of a disability or mental health diagnoses, any legal history, foster care, sometimes chemical dependency issues can qualify. But again, that is not an all-inclusive list. So if you have questions about eligibility, please contact us. Okay? Thank you so much.
Wonderful. Thanks, guys. I also want to just tell everybody that CMJTS is in 11 counties across the state of Minnesota. So just because you don't live in one of the counties that Delina and Mel work in, please reach out to us because we are all the way up in Pine, Cannabic. We're a partner with the Career Force system, which used to be called the Workforce Center. So our service area is large. And if you give Mel or Delina a call or a text and you live somewhere outside of their region, they'll hook you up with the right employment specialist to talk more about the youth program. And then also to, be connected with your local Career Force Center, because there's a variety of services that are free and open to the public. Everything that we do is free. We're here to help you grow your career and get a pathway that interests you. And we're also there to help the communities and the businesses grow. So first, I'd like to introduce our first speaker, Leslie, and she is from Cassia Life, and she is a senior recruiter, and she's here to talk about the career pathways and jobs that they have at Cassia Life. But before you get into your presentation, Leslie, can I ask you to just kind of share how you got to be where you're at in your healthcare career?
Certainly. Thanks for having me, Bridget, and happy to be here. Yes, I'm Leslie Farnham, and I'm one of the senior recruiters at Cassia. And how did I get to recruiting? Well, healthcare was probably a bigger end of. When I first went to college, I did want to work in healthcare. I actually wanted to work for the American Heart Association. I lost a family member to a heart attack, and so I wanted to get involved and help promote a healthy lifestyle and health in that way. And so while I was in college, I was a caregiver. I had done some nannying and worked at a daycare center in high school. And so kind of being a caregiver as I went on into college, that was a good fit. I wanted to be in healthcare. And so I went in communications because I wanted to help tell that story. So I have degrees in communication. And then recruiting is a great, I kind of fell into recruiting. But I do really highly value the time that I spent in college as a caregiver. It helps me as I recruit caregivers and nurses and aides because I've worked in that field. But yeah, always that passion to help others and be there. And that's what I'd say what we're looking for as, we look for candidates and things to come in and join our teams. So I'll share a little bit more about Cassia then, unless you have any other questions for me, Bridget.
No, what I think I'll do is when you guys are done with your presentations, maybe, Mel and Delina and I might have a few questions we might ask at the end. So we'll just save questions for the end.
Great. Well, so a bit more about Cassia. Cassia is an affiliation between Augustana Care and Elam Care. And we bring over 200 years of experience for caring for those in need. And we really strive to inspire both our residents and our staff to fullness of life. That's our mission, is fostering fullness of life. And so we encourage you to join our team. My email is right here in my name. So please do, as you heard from the others, please do feel free to reach out if you've got questions after you listen to this. That's part of my job as a recruiter, is to help you as you look at this path. And I know that you're young and high school students. We have opportunities. You can come in if you're thinking about healthcare down the way, or as we'll talk about culinary or therapy or social work. You definitely can get started with us. So Augustana, a little bit more about us. So Cassia, like I said, Augustana and Elam Care, we got married. We're a faith-based nonprofit, and we operate in 5 states. I have a map coming next, so I'll show you that, and you'll see the 5 states. But we joined together in 2018 to bring our entities together and created Cassia. So that name is new, but the history of Augustana and Elam is quite old, as you can see from there. Over 120 years with Augustana and over 90 years with Elam. And we provide, clicked the wrong slide. We provide long-term care, rehabilitative care. So transitional care is rehab care. So if you were in an accident or maybe had surgery on your hips, your knees, your shoulders, possibly from a heart attack or a stroke, you might be in and using our therapists. So that's transitional or rehab care. We have assisted living, independent living. We have adult day programs, hospice programs. We have our own pharmacy. We have a medical supply division. We have 2 therapy divisions. So lots of opportunities throughout our organization. We have over 5,600 employees, actually probably closer to about 6,000 nowadays, and we care for about 4,000 individuals on a daily basis. So what do we really look for and what do we stand for? I think that's a big thing as you look at a company is what are some of their standards and where you look at. And really in healthcare, that care and that purpose and that mission for caring for others is going to be in all of the organizations that you look at. But some specific for Cassia we really put forth is, we have an uncompromising quest for compassion and integrity and excellence and innovation, unity, stewardship, respect, and collaboration. So if you have any of those traits, you've been innovative in school as you've worked on things and you strive for excellence, that integrity, those are things that as you interview with us, you can talk about and bring to us because those are the qualities we're really looking for. We know you're young, we know you're a student, and it's okay. We will train you and guide you, but these are the things we're really looking for in our candidates. And I bet you have some of those skills. So where are we? I told you I had a map, so here's the map. We were founded here in Minnesota, both of the companies. Elam was founded in Princeton and Augustana in Minneapolis. So we have quite a few in the metro as well as outstate. We're also in North Dakota, Colorado, Iowa, and Florida. So the opportunity to start and where you live now, but as you look at going on to school, you could transfer, and we do. I have students that transfer that, hey, they're going to school up near Duluth, so they work at Moose Lake, but they live down in the city. So during school, they work at Moose Lake, and in the summers when they're back home, they might work at that Apple Valley facility. So that flexibility is in there. And we also do have seasonal or student roles that we do know that you can start in, and maybe you're going to school in Wisconsin, but when you come back on breaks or on the summers and holiday, you can come in and work for us. Some of the roles, and Bridget did a good job of kind of sharing some of the variety that we have, and there is a lot of variety. Not everybody does direct care. And that would kind of be in our nursing department. Obviously nurses, and we do hire both RNs and LPNs, but we have CNAs, a certified nursing assistant, and you can get your CNA at 16 in Minnesota and come on board with us, and those tend to work in our skilled or our higher acuity needs. But we also have home health aides or PCAs, and those can be in assisted living or memory care where maybe the acuity isn't as severe. But the health unit coordinators, or HUC as we refer to them, resident assistants, and then our support services. Now, some of these you're still interacting, but maybe not that direct care. But our activities assistants, if you're thinking about going for therapy, that's a great way to get involved. We do have therapeutic aides in our rehab units, but in our general communities, we have activity assistants, our custodial teams, maintenance, housekeeping, our social workers, our chaplains, because we are faith-based, so we have ministers and chaplains on staff. Our culinary team, one of the great things about in our world, no late nights and guaranteed hours and work. We aren't going to cut you because it's a snowstorm out and not a lot of folks are coming in. We're 24/7, 365. So breakfast, lunch, and dinner and snacks in there every day, all day, every year. So our cooks, our servers, dietary aides, dishwashers, registered dietitians oversee, because that's very important with medical interactions with foods and things. So those are some others. And then we do have from home office, we do have our IT team, our finance and accounting and billing, my world, HR, our operations. So there are other roles. Those do need to come out of the home office, which is in Edina. So just know that. And I think it's important to know what we offer you. We definitely look for those traits. Like I said, somebody compassionate, hardworking, innovative, towards excellence, with good integrity. But what are we going to offer you when you come in and work in our world? And not just us. I would say, as you're going to hear from Jessica too, any of us in healthcare, this is a meaningful job. The work you're going to do, be it a dietary aide, a housekeeper, a nurse, anyone who interacts, or even billing, everything that you're doing It's to help our residents and our patients. They will value you. They're going to appreciate you. You're helping them live that full life. And so coming into this world, your talents and what you bring to us are not only valued by your coworkers, but by those you serve. We have a lot of great training and support. Things are always changing. And in these current times with COVID, guidelines and rules and things have changed often. And so we have a corporate team of nurses that do compliance and training, and staff development is very key and very important in healthcare. And it's something that will be ongoing if you come into this world. Stability. Healthcare will always be here. So there is good job stability. I have folks that have been with us 40, 45 years. We actually just had a retirement of 48 years he had been with us. And he started as a janitor when he was in his late teens when he first came here. And 48 years later, he was the head of all building operations for all 50-some buildings we have. And he retired after 48 years with Cassia. So that's amazing. So you can grow, you can develop, but we do love students, even if it's just short-term that you are, you're working toward, you want to go for therapy, you want to be a physical therapist or occupational therapist or speech therapist and shift over to that division. You can come in and start with us now and get some experience. Those programs often do look for hands-on experience. And you can come in and join us. And we offer you that growth, our diversity and what we do. We have a very strong program called Ideal of inclusion and awareness. We are faith-based, but we honor all faiths that are out there. We want everybody to be respected and honored and have that integrity. What can we offer you as well? Benefits. We have really good benefits. Paid time off for both part-time and full-time. So a lot of students come in and are part-time, but you actually will earn some time off. The more you work, the more you earn, but you can take some time off and get paid while you're off. We have retirement plan with an employer match. We put some money in towards you. And that you can even start as a part-time employee. You can, after you've been with us a year, then you start getting our match, but you can start doing that. And it's never too early to start saving. Tuition discounts, really important for students as you're looking at that. These 8 colleges partner with us and give discounts to our employees. So if you take a class there, it varies. Some it's percentage, some it's a dollar amount, some of it's even family members. Medical, dental, health, saving plan, and of course, a great team to work with. What do we look for? Like I told you in the beginning, compassion, dedication. We want you to be reliable and dependable. We need you to, our residents and our colleagues are going to depend upon you. So, showing that you can be there. And just really that genuine desire to help others. We want you to really want to help others, and that respect and honor and integrity for seniors, for elders, because that's primarily who we care for. Good listening, able to read and write in English, because the orders, the medical orders, the care plans are in English, and the nutrition plans and things, and be a good team player. So if you've been on any sports team, volunteered in anything, participated in anything, share about those team events. And I'll end with, how do you apply? Because now you might be interested. How do you apply with us? It's very easy, right on our website. It's cassialife.org/jobs. You can email. My email is at the beginning, but we do have a general jobs email that we have here that emails the entire recruiting team that's out there. So you are welcome to apply and reach out to us if you have any questions. So thank you. Any questions for me? And I'll jump back to the first slide, so my email's back up there for people.
Thank you so much, Leslie. That was really great information. And I appreciate you sharing your story and your journey, because I think it's important for us to show that, we've all kind of grown and moved forward, taking different directions and leading us to, the chair we sit in now, because it's a process. So I really appreciate that.
Bridget, can I jump in? Can I ask Leslie a question? Okay.
Yeah, go ahead.
Leslie, first of all, piggybacking off of Bridget, thank you so much. That was really informative and great. I wanted to ask you, what would be an interview tip you would have for youth or young adults? Maybe just one interview tip.
Yeah. Don't be afraid to show your confidence. we do know, and part of what I mean by that is that we know you're young, if you're a high school or a college student, a young adult, we know that. We know you don't have a ton of experience. We see that. But be confident in yourself that I am a caring person. I am somebody that wants to contribute. So showing that I am compassionate and not being afraid to show that you care, show that you really want this job. And I know, because it's scary. So that's the end. We know you're nervous, but don't be arrogant. But we're Minnesota nice. It's okay. Be a little confident in yourself. So that'd be my one big piece of advice.
Perfect. Thank you, Leslie.
You're welcome.
That's a great question, Mel. I think it's important for young adults to know that just be yourself in a job interview. Be your best self, but show your personality, because that's you can always teach skills, but you can't teach personality. You can't teach compassion. So that's a great question. Thanks so much. Now I'd like to go to Jessica, who is a recruiter with Monarch HealthCare. Welcome, Jessica.
Yes, hello. Thank you so much for having me.
Yeah, it's great to see you. So I'm going to put you on the spot again, like I did Leslie. If you could just share how you got in your chair, how'd you get to where you're at right now, and then jump into your presentation.
Yes, absolutely. So I actually come from a family of caregivers. My mom was in nursing, and so I kind of grew up with that. I grew up babysitting, nannying, same thing as Leslie. And so when I went to college, I actually switched majors a ton, because I started out in social work, and then I switched to education because I love kids, and then I switched to business. And as I was trying to figure out which asset of business I wanted to go down, which road, I chose healthcare management because I know that it's always going to be a stable field. I know that I'm going to be able to get a job anywhere because healthcare is everywhere and it's not going anywhere. And I still wanted to stay true to who I am and help others in any way that I can. I know that for me, it wasn't going to be in that direct care role. As I've done that, and I knew that I wanted to do more administrative behind the scenes support work. So I went to University of Minnesota Duluth and graduated, and then came on to Monarch's HR team, and I've loved every minute.
Thank you so much, Jessica. So tell us about Monarch HealthCare. What's great about where you work?
Great, yeah, I will pull up my PowerPoint and share about Monarch. Okay, can you see my screen? All right. Here. I will just go ahead. Okay, so Monarch Healthcare Management. So Monarch is a relatively new company. We started about 5 years ago in 2015 with 3 buildings in Mankato, and we've grown over 400%. We have just under 40 facilities within Minnesota, 1 in Superior, Wisconsin. And I would say that growth is truly a representation of our dedicated staff and all that they have done. Our team's ability to care for people, that's really what has made us grow so quickly. Our mission is to change the way short-term rehabilitation and long-term care is delivered. We strive to make patient care our first priority, and just making sure that our residents' needs are put first. So here are some of our locations that I mentioned. We have a handful in the metro area. We also go up north all the way to Virginia, but we have a couple facilities in Duluth and Superior as well, if that's where you're planning on going to school or relocating after high school. Otherwise, we have facilities to the west, like in Litchfield, Winstead, that area, and also south of the cities such as Faribault and Mankato. So I want to go over just different roles within Monarch and within long-term care in general. So you can see that not everything is hands-on direct care, and you can get an idea of all of the different roles within long-term care or within Monarch too. So to start out, an administrator. So an administrator leads each building, each facility. So each one of our buildings has an administrator. Some even have an administrator assistant, things like that. But they do the budgeting for the building. They just run the overall operation of the building. They manage each department of the building, such as culinary, nursing, maintenance, things like that. So they're kind of the leader of each building. And this, to be an administrator, you do need a master's degree or a graduate degree after your bachelor's degree. So that takes a little bit of schooling. A human resource director. So this is kind of my world. Each building has a human resource director. So if human resources is what interests you, there's definitely a role that plays at each building and at a corporate level as well. So our HR directors are in charge of our employee records, documentation, doing payroll, things like that. And then our social services director or our social worker, social services designee, anything social work related. Each building has some sort of social work presence. So if that's something that you're interested in, you would be able to go down a lot of career pathways in healthcare and in long-term care in general. So they kind of work as a liaison between the residents and families and facilities, and just make sure that admission is a smooth process, and things like that. Discharge is a smooth process. Our Therapeutic Recreation department or an activities department, same thing. They just make sure that residents' needs are met, that the residents are encouraged to social interaction, and they evaluate their likes and dislikes in programs so that they can coordinate different events and organize different activities for the residents to do to make sure that they're enjoying their time wherever they're at. They also have assistants, activities assistants, and that is something that you can do at the age of 16. So if activities is something that you would be interested in, you can do that in a volunteer capacity or part-time, full-time in the summers. That is an opportunity to you after the age of 16 as well. And our health information director. So our health information director records resident records and doctor's orders, things like that. They audit and make sure that the medications are correct to the physician's orders. They maintain residents' information and billing. So if you're a very organized person, this could be something that may interest you. They also have assistants and things like that. So you don't need to jump right into health information director. There are health information assistants as well. And maintenance. So each facility has a maintenance director. Some have maintenance assistants. And these people are in charge of plumbing, electrical systems, and any touch-up things that may need to happen over time, such as fire alarm tests and emergency electrical systems, heating, ventilation, air conditioning, things like that. They do a lot of repair work. They truly help every facility just run their overall operations. And so if this is something that you feel is a skill to you, you can definitely get involved and start as an assistant or start shadowing. Every facility has one of these, so they are definitely in demand as well. Or maybe you want to be in direct care, and that is something that is interesting to you. We, as all long-term care facilities, have registered nurses, and they kind of oversee our LPNs and our CNAs as well, but they track the data and do assessments of the residents. They help develop the care plans, chart, administer medications correctly, and ensure proper documentation. They truly make a big difference in our residents' lives. And the great thing about our RN positions is there are a ton of leadership positions available within them. So we have director of nursing, assistant director of nursing, nurse manager, and an MDS coordinator, which works with insurance and things like that. But there's a lot of opportunity being an RN. And even if you decide you want to be an RN, but maybe you want to be an RN at a hospital or at a pediatrician clinic or things like that, a lot of nurses will come to our buildings and get experience first and then move on to the hospital. And we totally understand that and we embrace it because we're happy to have anybody who truly cares about their residents and their patients. And a step below an RN would be a licensed practical nurse, an LPN. And at Monarch, they are also involved in our care plan process, and they adhere to standards of care and follow specific policies and procedures. They help chart and help facilitate all physicians' orders, administer medications, a lot of similar duties to an RN, just not as involved as RNs are. And a CNA. So I will talk about our nursing assistant in training program in a little bit, but CNAs are kind of our direct care one-on-one. You help the residents with a lot of things such as dressing, grooming, bathing, feeding, toileting, transferring, walking, positioning, things like that. They're really our frontline staff. And so when we look for CNAs, we really want someone who can ensure that our residents' dignity and make sure that they're helping support all of the residents' needs in working together with our other nursing staff to make sure that our residents are truly well taken care of. And a CNA is a great opportunity to get patient experience. So if you're planning on going to be a registered nurse or anything in the healthcare field, they want patient experience. And so getting these hours in now would be a great opportunity. And Monarch, one great thing that Monarch does is we offer a nursing assistant in training program. So say you want to be a CNA, you can apply to Monarch and we will provide the CNA training to you for zero cost to you, which is great. We'll pay for all of your exam fees, your books, supplies, and the actual course itself. So it's a great way to get involved, and it's about a 6 to 8 week program. And then after that, there's no obligation to work for Monarch after this course. We would love to take you on as well, though. And then our culinary department. So we have culinary aides, culinary cooks, and then each facility has a culinary director, as well as some corporate level positions as well. So say culinary is a field that you want to go into, you can start by being a culinary aide now while you are in high school or right out of high school, just to gain that experience and see if that's something that would be interesting to you. Our culinary department definitely makes a positive impact in all of our residents' lives as well. So benefits of working at Monarch. So we offer part-time, full-time, and casual hours. So we can definitely work with your school schedule and any other activities that you're in. Like Leslie mentioned, we have facilities all over Minnesota. So say that you are in our facility in Duluth and you plan on going to school in cities at one of the universities in the cities. We can work with your hours on holidays and around your school schedule, which is a great thing about having facilities all over Minnesota. We have different shifts available, like I mentioned, health insurance, 401k, paid time off, all of that good stuff. We have a 20% tuition discount with Rasmussen College, Rasmussen University, which is great. But we also do nursing tuition reimbursement with all colleges. And that's a certain dollar amount each month that you can put towards loans once you graduate, or you can put towards your tuition if you're in school. So that's an awesome opportunity with Monarch. And just your ability to grow with Monarch. If you start out as a CNA, and we'll help you pay to get your LPN, we'll help you pay to get your RN, however far you want to go, we can help you with that. So there's truly lots of room for growth within Monarch. and how to apply if you are interested. You can always go to our website, monarchmn.com, read more about who we are, see our different facilities, our different locations. If it's something you're interested in, you can go to careers and follow those steps on that website. And if you have any questions, my contact information is at the bottom, my email and phone number.
Thank you so much, Jessica. That was wonderful. A lot of opportunities at Monarch. So I just had a question. You talked about some of the incentives that you have for your employees. Leslie, can you tell me about Cassia Life and how they support their employees to grow their career in healthcare?
Yes. So similar like Jessica, especially if you're in that nursing field, Minnesota has passed, the legislature has passed to help in the elder care, what both Monarch and we do. So kind of really focused on the seniors. And so that is a really nice benefit that we can offer nurses, is that loan forgiveness. And they did just raise that. It's $24,000 that you can have forgiven, just wiped out in your student loans. You have to work full time, so you're going to work full time, get paid full time, so you're making the money, getting those benefits. And at the end of a year, you have to apply and qualify. We have to verify as an employer or Monarch and say that yes, you do work with us as a nurse. And once that all goes through, it's I didn't do the math to know when they upped it to 24, but yeah, that each year, that it's about $5,000 that's taken off of your student loans. But that is if you work in elder care, in senior care, because we're not the babies and the youngins. So, but it's great. Come in and work in our world. But in addition, similar to Monarch too, that we do have some scholarships and available on top of the tuition discounts. So I always like the tuition discount, as I kind of shared on that, is that no matter what you're studying. And so we have folks that will come in and they are like, I want to go for engineering, but I do have a kind, caring heart, but I want to end up at Boston Sci or Medtronic and like help make a pacemaker because they're drawn toward healthcare. You can still work with us and get that discount at Augsburg or at Bethel. So it doesn't have to be. So that's kind of the difference to know between, and the same like with Jessica at Rasmussen, you can work with us, be studying whatever. If you study certain fields, social work or things that we employ, then we have potentially some more scholarship funds. But I do tell people, and we're okay. If you're hardworking and dedicated, maybe it is. Your mom's a nurse or whatever, but it is. Like I said, you're going that engineering path. We need those things developed for our residents. I will gladly take you as a hardworking, reliable, dedicated server or dietary aide or maintenance worker and have you do that for several years with us and help you save some money at school. So we have those benefits, but yes, the scholarship, the give back. We're a nonprofit, so even and so that even coming in and working with us, that you might be able to get some. A lot of lenders will lower their interest rates or give you a discount as well. So even if you were, already have gone to school and come to us, we can help save you some on that. So I there's lots of little things about coming to work in this world that can help you save some money and make money. As you started off, that working in this world, that, and even in all our roles, our culinary and our maintenance, as I'll go through, as Jess, what we go through, it's not late, long hours. Our maintenance do get called in. It is Minnesota. If we have a snowstorm and the power goes out, yes, you might get a call. But it's not late nights as a chef. You're not till 1, 2 a.m. until the restaurant closes or that, Our chefs, and I'm sure Jess is too, most of them are out by like 7, 8 o'clock. Kitchen is clean, kitchen's done. If any of them are past 8, that's really unusual. So that work-life balance of coming into this industry is really nice. And I know that Monarch offers that as well. So
thank you so much. That is so, you opened a can of worms with medical manufacturing, which is a huge industry. Because all of those things that you use in your care facilities are being made somewhere else. So that's a whole other conversation. I just want to see, did Lena or Mel, do you have any questions?
I do, actually. I always have a question. Can I ever stay quiet? Leslie, I actually have one question for you and then one for you, Jessica. So, Monarch, it sounds like, Jessica, you at Monarch, you offer CNA training for those interested in CNA, right? So I'm wondering if Cassia Life offers any CNA training as well.
Yes, we do. I have several facilities that we will actually do the training on site, that we have certified trainers right on site. So yes, you can come in. My Buffalo, so kind of probably the closest out there is Buffalo, kind of in the region. We're still getting Dassel set up. But my one's in the city if you're looking to come in. But even if we don't, that hey, you're at Ridgeview and looking at that, and so that's fine. We'll reimburse it. So just like Jess said, that we will pay you back. And not only is it the class, as she said, and this again goes with some of our grant. So if we're your first employer after getting your certificate and it's in senior elder care, we will reimburse the tuition, the books. You have to get scrubs, we'll reimburse your scrubs. So save all those receipts. If you needed transportation, there's a little bit you can qualify potentially for if you needed daycare or any kind of assistance on that end. But it is your first employer. So if Monarch was the first place you worked after getting your certificate, or Cassia or whomever, and ask. And we try and tell you, but depending on who's hiring, because we will reimburse it. So save all those receipts. But in ours, we do have, and we have a blend, especially with COVID. We were doing this before COVID, Leading Age Minnesota, and that covers like everybody that kind of works in elder care. It's called Leading Age Minnesota. They did develop a hybrid program for teaching CNA. So it's approved through the state. And so we have ones that do that as well. So you're kind of learning I describe it like driver's ed. So going through your CNA is like driver's ed. There's a written test, and you have your behind the wheel. There's a written test, and then you've got your hands-on skills. Show us you know how to wash your hands well. You can get someone into a wheelchair. You can assist them out of the wheelchair. So there's those skills. You're going to learn how to properly protect yourself, to lift someone and assist them in or out of bed. But so that the learning that you do, so there's a hybrid. You can do some online, but you have to do clinicals. You've got to come in and practice with each other and help them get in and out of that wheelchair, help them walk down the hall, use a walker, use a cane. And we make sure that you're trained. That's why we kind of talked about training. So yes, the CNA training, the med tech, so you can go up another level. So we have like ours that start, like you can start as an RCA, a care assistant. Then we've got a basic care aide where we do some training. It's about 8 hours. Then you move up, you get a little more pay. Then you can go to a CNA. Then above that is a trained medication aide, and you have to have your CNA to get that medication. We'll help pay for that. Then you can go to LPN or RN.
Awesome. That's great. That's great to know. Thank you. And I also too wanted to point out for any youth listening that maybe aren't in any of these areas, Delina and I can also sometimes help pay for CNA training to then apply to agencies too. So there's so many avenues to help you pay and get CNA training, which usually is about, give or take, $1,000. Yeah, so it's a really good way to get it paid for and to get in a job that's paying really well and really in demand in our area. So, very good. Then my question for you, Jessica, is, so I oftentimes help youth with applications and resumes. And I want to ask you, do you think it's wise for somebody to have a resume started and maybe like a first one developed in high school? Or is it really needed? Sometimes I have youth say, well, I filled out an application. Why do I need a resume? What are your thoughts on that?
I would say it's never too early to start a resume. You can always have your skills on there. You do have skills that can pertain to any job that you're applying for. And even if are in sports or theater or things like that, like showing your dedication to put on a resume. It's never too early to start a resume. And we definitely look at them and we appreciate them, and ask for feedback on your resume. If you have any questions to your employer, we'd love to have that as well.
Awesome. Thank you, Jessica.
Mm-hmm.
Thanks, Mel. You've always got questions. So I want to just thank everybody for being here, Mel and Delina. Please reach out to them or myself about the youth program and CMJTS services. And then to you, Jessica and Leslie, I just want the youth out there to know that none of us ever know what we want to do for the rest of our lives. We just have to figure out what we want to do next. And then we learn from there, and then we do the next thing. And starting a career in healthcare is awesome. If that's not where you end up at the end of the day, that's fine too. There's support, there's information, and you're going to learn about yourself and what you're good at as you go through the process. So again, I want to thank everybody for being here. I look forward to sharing this presentation with high schools and anybody that's interested in learning more about Cassia Life and Monarch Healthcare. So thanks again, guys. We'll see you later.
Thank you all.